Leanne Johnson. Welcome to this morning's post-cabinet press briefing, wherever you're joining us online or via GIS channel 22. And good morning to all our colleagues in here this morning. I am sitting in for Press Secretary Ms. Philomena Robertson, and we're continuing our discussions on COVID-19. So with us today, the Honorable Minister for Health, Nickolas Steele. He is to my immediate left, and to his left, Dr. George Mitchell, former Chief Medical Officer. He is now the COVID-19 Response Coordinator. And as I mentioned, we're continuing our discussions on COVID-19, what the government is doing to ensure that Grenadians remain safe in the face of the virus. And we also have Ms. Ashel Charles from the School for the Deaf, of course, communicating to the hearing impaired community. So I hand over now to the Honorable Nickolas Steele.
Thank you very much, and good morning to you all. Let me start by clarifying or making the most important announcement right now, or development overnight, is our increased travel restrictions. We have placed travel restrictions on individuals who would have a travel history in the last 14 days to Italy, Germany, Iran, South Korea, and China. This will continue until further notice, and we are looking at other countries as well, possibly before the end of the day, that we would add one additional country. But this is a fluid situation, and we keep monitoring it. That would mean that Grenadian citizens and residents of Grenada who have a travel history from any of these countries, if they return back to Grenada, they would be quarantined for 14 days. And non-citizens and non-residents of Grenada would not be allowed in. Apart from that, we have been doing much of the frontline training and interaction, which I'll have Dr. Mitchell speak to you further on, as well as for him to show you one of the test kits so that you know they are here. It's regrettable, but we do have to go the extra distance to actually physically show you, because I do understand that some people have been doubting that they are physically here. So Dr. Mitchell will also show you that and describe to you the process of being tested if, God forbid, any of us needed to be. So having said that, I'll pass it over to Dr. Mitchell, and then we can take questions and further comments. Thank you.
Good morning to you all, wherever you are. Good morning to the media. And I must say thank you for your positive coverage over the last press briefing that we had. And I am confident that with the partnership that we're building, that the responsibility of ensuring that we inform our populace in terms of the facts as they present themselves is going to continue. As of the last press briefing that we had, I enunciated our 5 strategic lines of engagement, and we've been using that to ensure that we strengthen, that we ramp up our preparations as we go forward. And I'm happy to say that we are really now fertilizing, strengthening those areas. And I have been out speaking to groups that are interested in ensuring that we do have the appropriate plans laid out, and those who we consider to be our frontline staff and workers, and that has gone extremely well thus far. I've had the opportunity to personally speak with the folks at Port Authority. We had an extremely exciting meeting last week. I think it was Thursday, where over 35 to 40 participants were present. It was extremely engaging, and I can see that we are actually building the confidence and consensus among these workers, because we're able to clarify a number of areas where there were uncertainties. We also had our meeting of the Sanitary Authority last Wednesday. The Sanitary Authority, as was mentioned, would have been sort of like not revamped, but we got together and ensure that members were aware of the legal powers that authority had and where it lies, and to ensure that we're doing what we know supposed to be doing based on the legislation that we currently have. So that just to say here that whatever we're doing, that we have the legal backing, that the efforts to quarantine, the efforts to isolate, etc., are well within our legal rights to do so. I had a nice meeting as well. The team, more so, had a nice meeting at the Maurice Bishop International Airport. I must say that this was not the first meeting. It was actually the fourth meeting that we had down there to further clarify what is happening down at that particular institution. It is our biggest gateway, and we're building the partnership, we're building the consensus. I think folks there are much more in tune with what our lines are and what needs to be done in the current circumstances. We also met with the Tourism Authority, a representative of the tourism industry. We had, their buy-in. I think it was a very, very instructive meeting as well. Those folks are the ones that are representative of the travel agencies, etc., to get them on board with what we were doing. And I must, thank the management of that authority for giving us the opportunity and building that partnership going forward. And just yesterday, I was asked to speak to the hierarchy of the Royal Grenada Police Force. We had, I reckon, everyone in the room. It was a very, very enlightening meeting. The police is on board. In other words, they are front line to a certain extent, knowing that they would be asked to help respond if that needs come about in terms of maybe ensuring that persons are quarantined, etc. So the police as an institution is also readying themselves for whatever eventuality. Yesterday afternoon, or morning rather, we met with the community nursing division to ramp up what we've been saying regarding ensuring that we visit our elderly out there in the communities, and that our strategic line number 4 is basically being addressed, and we're confident now that we're getting that kind of buy-in and implementation of that particular strategic line. And I had a really, really nice meeting as well yesterday, and you might be asking me how many meetings that I had yesterday. Yes, quite a bit. With the Ministry of Agriculture, particularly the quarantine division. Some of those workers work at the international airport as well, and we had really a nice, lively discussion. And some suggestions were made in terms of ensuring that we sort of like continue to fine-tune our efforts in that regard, where that section or segment of the workforce is concerned. I think we clarified some issues. I asked them specifically to bring their recommendations to ensure that they are safe and that the country is safe going forward. So that was a really, really nice meeting. And the last meeting that I had yesterday was with Customs. And we, from 3 o'clock to thereafter, we had a really nice sit down, a nice chit chat with them. They asked a million questions, clarifications as to what the virus is and how they and their role, clarifications in terms of cruise lines, yachting industry, packages, and all of that. And I left the meeting feeling that we had addressed those concerns and that the workers in a better place, feeling much more comfortable in terms of how we are responding in generic terms to the current virus. So I'd like to stop here. Maybe I had too many meetings yesterday. I'd like to speak to our ability as per strategic line number 5, building capacity not only among our staff, and that is continuing. I spoke to Dr. Dolan this morning, who reassured me that preparation in terms of staff and training and the hospital plan per se is well on the way. And so that is happening. I'm talking about less than an hour ago. And in terms of our ability to test and equipment, etc., Minister alluded to the fact that, yes, we currently have the necessary kits to be able to swab and test persons if we suspect them to meet the necessary definition for testing. We do have the capacity to do that swabbing and to send it off today. You want a picture of it? Yes, that is it here. Okay. So I now open the floor for questioning, or if Minister would like to.
Just to say that you're aware, it is a fluid situation within our region, our hemisphere, that those countries that fall under Pan American Health, which is everybody from Canada all the way down to Chile, including all of our islands. There are 663 cases at present. 489 of them are in the United States, and the rest are dispersed from Argentina, Brazil, Canada, Chile, as you are aware, Colombia, Ecuador, Dominican Republic, closest to us, and our sister islands of St. Bart's and St. Martin. Both have cases. Those cases, as far as we are aware, are imported cases. So we still maintain our diligence, and there's open communication between all of the health ministers of CARICOM consistently, as well as with CARFA and Pan American Health. We had, as you were aware, I think we had a delegation from Pan American Health Organization here late last week. They were here on other business, but part of that delegation was also the same individuals who would be responding and who are have oversight. So we had them look at our facilities as well and discuss some of our protocols just for reinforcement. And they made comments, I think, for themselves independently. Thank you.
Thank you very much, Minister and Dr. George Mitchell. The floor is now open for questions. Please identify yourselves and your media house and proceed to ask your questions.
Rena Pierre, GBM. My first question, Minister Steele, could you give me an update as it relates to the meeting that was supposed to happen between your team and the Grenada Trade Union Council? And also, where are we now as it relates to the Cuban nurses coming to Grenada?
The ministry did meet with the Trade Union Council. Permanent Secretary met with a delegation. The reports back from the meeting or minutes of the meeting were quite positive in terms of the Trade Union Council stands ready to interact and participate in our preparations. From our standpoint, we were very pleased from the reports I got that I am very pleased that the Trade Union Council was willing to assist in providing trainers that we can train so that they can disseminate information as quickly as possible to the rest of their membership. That line of communication will remain open so that we can be sensitive to any of the concerns that we may have not thought about, any of the concerns from their members. So we welcomed it. I welcomed it last week, and as far as I'm concerned, it continues to go well. With respect to the nurses from Cuba, we have communicated to the Cuban government through the embassy here about our request for nurses. We've given them the specific nurses that we are looking for, and we await their response in terms of when they would arrive. Also to mention, apart from the trade union, we are looking forward to this week on Thursday, meeting with the social partners, all of the social partners. It probably would be in this room, and to engage them as well.
This month, we're recognizing nurses and midwives, or this year. So I'm wondering, where are we at as it relates to our midwife situation, and as it relates to training with new midwives, or as it relates to, just developing their art as it relates to that?
Well, The year is International Year of Nursing. If you look at our Facebook page too, you can see that we recognize them. They are our frontline workers in this COVID response as well, as the web that holds our health system together. So the ministry intends to play a very active role within our limitations in the celebration. In fact, Grenada will be hosting a major conference of nurses later on in the year. I believe it is September or October. So we're looking forward to active participation in that. We did have a meeting with the Nursing Association already to discuss that and some of the other issues. And with respect to the training, we are looking forward to starting training, midwifery training, very shortly. And as you know, we announced that we would be also starting nursing assistant training as well. And from the midwifery, let me stop and welcome our Prime Minister.
We just took a brief break just to accommodate the Honourable Prime Minister, Dr. the Right Honourable Keith Mitchell. Minister, continue. Thank you.
Yes. On the question of nursing training, yes, midwifery, as well as though we're looking to start training in intensive care, accident and emergency, and oncology and nephrology as well. But the first one to start will be midwifery.
Is there any shortage as it relates to midwives?
The situation that existed last year is still the same situation within the region with respect to the migration of nurses that caused a shortage. So yes, there's a shortage of nurses in general, not just in Grenada, but in the region. And in midwifery, yes, we would be experiencing that as well. That's why we would be looking to train. That's the first area of training nurses. Similarly with most of the other islands as well.
Question, well, the last one. We were just talking about the Cuban nurses, bringing them in. Are there any strategic plan as it relates to replenishing our health system as it relates to nurses? I know that we're bringing in some of the Cuban nurses, but is there any other strategic plan that is happening right now to keep our nurses here?
Well, we've been training nurses. We, in partnership with St. George's University, we train over 20 nurses a year. And that's the sustainable number that we're able to train. With respect to keeping our nurses here, I know of 1 or 2 nurses that have returned since, that have gone to the UK. Wasn't the bed of roses that they were expecting, and also and have returned to Grenada. So our population migrates and our population returns as well. We endeavor, I would most definitely, Prime Minister, and I most definitely would love to pay everybody enough to keep them here and keep everybody happy, but that is not possible at this time. And as soon as there is a possibility that we can all lift up as a nation, then that is the road that we are taking. We're all slowly moving forward. We cannot identify one single sector at the expense of another. From where I sit, though, I would love to get that instead of teachers, but we have to share among ourselves.
Let me just make a point on this issue of nurses. Realize that probably the entire Caribbean is suffering from this. It's not a Grenada problem, because sometimes I get the impression they say that because of how we treat our nurses, they're leaving. It means that the Jamaicans are treating their nurses badly too. The Trinidadians are treating their nurses because they're trying to import much more nurses than we do in here. Barbados, which is the prime institution for healthcare, when I was living there in the 70s, as going to school, today Barbados is getting applying for hundreds of nurses, and they have a nursing school which is incredible over the years, for the last 40 or so years. So we have a problem in perception of things are better out there, and they can make a lot more money and so on. But we also have to ask people to be, their commitment to their country is sacrosanct. We all make sacrifices in some form or the other, and no country would be able to pay so much more that you're able to create a disincentive for you to travel for one reason or the other. And so I just wanted to debunk that myth about how government is treating its nurses. That's why they're leaving, and the conditions for nursing care and so on. We'll continue to train. In fact, there's a serious proposal on with a group now to look at who are establishing an additional school here. And nursing will be a serious component. That's an international institution. So we may be doing much more. So what we'll hope to do is to train a lot more nurses, a lot more young people, boys and girls. And therefore, if some go and we keep enough, then we have enough to satisfy the needs of our country. So I just wanted to make the point for what it's worth. Minister?
Good morning, Rachel Bain, MTV. Minister Steele, my question is, do you have the data on the number of Grenadians working on cruise ships, especially with COVID-19, and what will happen to them upon arrival? There are confirmed reports of Grenadians who are crew members of Grand Princess, whose passengers disembarked in Auckland yesterday and today. Some crew members are expected to return home.
The same applies for any Grenadian. Any Grenadian coming home from a high-risk area, or, in the instance, yes, we do have the names of the Grenadians who were on Grand Princess. If they were to return home, they would be immediately quarantined. If they were to be allowed on an aircraft on the other side, I cannot stop that. But because they're Grenadians. And the assumption is that on the other side, in the United States, that they would check them thoroughly and make sure that they are asymptomatic, show no signs of COVID-19. But once a Grenadian arrives here from any high-risk zone, they are immediately quarantined for 14 days.
Okay, so presently there is no known cure for the virus, and reports are different countries are experimenting with different drugs. What will be Grenada's choice of treatment?
Dr. Mitchell, you want to?
Yes, thank you so much. Yes, you're absolutely correct in saying that there is no treatment per se, and that there is no cure, corrected, speaking like a medical doctor, for the virus. But the strategy is basically to support, to ensure that persons are experiencing the best possible health, and to ensure that we have all the supportive mechanisms to assist with the treatment of those cases. So yes, you're correct. There is no known cure for it. We are watching the developments in the places where those experiments are being conducted, and we will basically seek to advantage ourselves with those when the time comes.
Prime Minister, good morning. Well, we're speaking money now, right? So, will self-quarantine be treated as a sick leave, and will government allocate money to the NIS to assist specifically with COVID-19 cases?
Just remember that we have a special case in our hands that we never projected that we would have to deal with. This is an issue of COVID-19 is engulfing all aspects of government, finance, and every single area. Just to inform that we had a heads of government virtual meeting on Sunday, and all the country's leaders who were present. We had about 9 to 10 of, I think 10 of us, yes. And they're all talking about the seriousness of the problem that they face and the financial problems that are involved in meeting the challenges, because there's so many things that you have to do that requires resources. And it was brought to attention that the international communities was taking initiative. The IMF, for example, and the World Bank. They are convening a meeting. It's supposed to be on Thursday, but it's now shifted to Monday at 2 o'clock in the afternoon to meet with ministers and prime ministers of countries in the region to look at direct support financial, and that it has to be immediate to deal with the problems that we all face. So, in addition to the local resources that we are in fact putting, which is of course will be limited, remembering the problems that we face in so many areas, they are. So we have to look at the economic impact of the virus on several areas, on the healthcare system, which of course is number one. Also, the question of the hotel sector, and we have to look at the cruise ship area, for example, is another key area, because by not accepting certain ships, you are in fact affecting the livelihood of a lot of ordinary folks, the vendors outside there who make a living 6 months a day or 5 months a day. You know, with the peak of the period when they expected to, they would have bought up a lot of stuff and expecting to make $1 to take care of the family. Now the ships have to, some of them are being turned back or making decisions not to come to certain ports. It's affecting them, so we have to deal with that. We can't get away from the fact that we have several other areas that we have to do. The social area might involve much more direct support for several sectors of the society. We do not want, the plan is not to send home workers at this time, so it means that if you're not sending workers and people are making less money, it means that we'd have to subsidize several workplaces, whether it's hotels, whether it's the retail sector in the country. All these are going to be looked at. So we had this morning a meeting with some key players already, looking at preparing briefs for that meeting on Monday for me, and of course, and whoever I choose to bring into that meeting to deal with the problems. So we will have sufficient resources, but I cannot tell you all will come from the local coppers. But we everything else is secondary. Let's face it, life and death. We have to protect our people. We have to protect ourselves. So we have to invest in all aspects of protection for this country as a whole. One of the things that we have continuously want to remind everybody, this is a national issue, and it involves everybody. And in fact, the invitation for the meeting that we're having on Thursday afternoon is a major meeting that we are inviting all stakeholders, the hotel sector, the Ministry of Tourism, the GTA, the cruise representative, the firms that are agents for the cruise ships coming in here, the port authority would be represented, the hotel association, that sector would be represented also. You also want to have the trade union movement, different, not just the trade union council, but different members of each trade union, because they have their own membership and needs, because we may have to subsidize some of the workforce in several areas too. So it's going to be a national issue in every single form. We invite in the official, we do not have an opposition in Parliament, but we do have opposition in the country. And we consider the National Democratic Congress as the leading opposition force in the country. So we will be inviting them and any other party who is interested, because this is a national issue that affects every single body. So it must not be seen as any one political organization should be involved. In the area of food security too, Ministry of Agriculture, the farming community would also be invited. So we're inviting every single major stakeholder in the country to that meeting on Thursday. I may not be present, because as you are all aware, that I don't know if you're aware, and I could make the announcement now, that I have been one of the persons asked to lead a delegation of leaders to Guyana tomorrow to attempt to bring some semblance of peace and order to Guyana at this particular time. Those of you who may remember, 1997, I was the chairman of CARICOM. We had a similar situation in Guyana where the results of the election were not accepted by the opposition, and there were quite some upheaval in the country at the time, and I had to go in there and try to bring peace, and we were able to resolve the issue as CARICOM, leading that process. So we've been asked, so myself, Prime Minister Motley, who is chairman of CARICOM, Prime Minister Gonzalez, and Prime Minister Skerritt. We are considered to be three of us, considered to be three of the oldest serving leaders in the region. So we've been asked to join the chairman of CARICOM on a mission to Guyana tomorrow. I hope I can be back in time to 2 o'clock meeting on Thursday, but if I am not, then the acting Prime Minister, Gregory Bowen, would in fact supervise that particular meeting. But we all have to work together, and I'm asking everybody, this is not a time for propaganda and name calling. You know, it's frightening when you see, we take social media and you see the kind of stuff that come in, or we let in Chinese come here and then plane flight come in, and oh my, you know, why are we doing that to ourselves? You know, we are turning ships away and certain countries accepting them. We're turning planes away and certain countries in the region accepting them. What we want to do, in the meeting this morning, we talk about we must be fact-based when we turn in people. We must have facts based on what we know exists, or technical people. It's not the politician must make those decisions. I am not an expert on health, and I would not try to be. So anything we do at government level, we have to be informed by our health experts and the persons who have the expertise to tell us, because we do not want one person here that will cause problems for our health system and our country as a whole, because we have to live here too. I can't want anybody to come here. I have family and friends, and I have a responsibility, and every minister, everybody has a responsibility for their own health and that of the country as a whole. So one has to, all of us must accept personal responsibility in going forward, because this is a serious issue we are facing. I mean, you saw what's happening in the United States. The President of the United States himself is coming under pressure for how he's handling the situation in the United States. I don't think they were of a bargain that they had to be dealing with this issue the way they. Look at what's happening in Italy. There's almost the entire country on lockdown. You want a situation in Grenada where the entire country is locked down? But please, God forbid, we none of us want that in our country, and sometimes we might be overacting to the point that fear takes over everything, and then we might say ban. You have to live. You can ban everything from here. The great United States, most of our citizens live in the United States. Those are abroad, Canada, United States, and other parts, London, and so on. You're going to ban people from coming from the United States now? Are you going to ban them? We have to do all the preparation, the isolation centers. There's a lot of things we have to do. And all we're doing is call on every citizen to recognize the seriousness of this, and we should not play games with this. I just want to make that point. I mean, I went through a long piece to try to, in a way, indirectly or directly answer your question, but it's a serious issue.
So with regards... Sorry. Minister Steele, self-quarantine, will it be treated as a sick leave?
Look, at the moment, individuals who would be asked to self-quarantine are individuals who are returning to the state, or individuals who have been abroad and visiting the state. To be honest, I'm not sure on that. This is a new thing, and I don't think the NIS catered for quarantine or self-quarantine, and so we have to take it case by case. I think individuals will have to take it case by case. I feel strongly enough that if we are telling Grenadians, as we did today, don't travel to certain countries, and they do, and when you come back, you are put under quarantine, then the question has to be asked, why should the state and the taxpayer take that burden? If the individual knew and went, but also there are instances where it's essential or necessary for that individual to have traveled, or that individual may have been there and trying to return home, like our citizens who are working on cruise ships. And they're coming home, so we'll be quarantining them when they come home. And I've found so far the Grenadians that have been asked to be placed under quarantine have been most cooperative and understanding. Those few students who came from China to Grenada that we asked to quarantine, most willing and never asked that question at all. Because they're very understanding that this is something that we're all in this together. And none of us should be looking at trying to benefit from it. So that question, I hope, doesn't come up forcefully that we have to. The Ministry of Health and the government has made sure that where necessary, we provide food for the individuals in quarantine. And some individuals in quarantine have not requested food every day or so. They've said they can fend for themselves as well because they understand. So I'm hoping that everybody adopts that same policy and principle, that this is something that we have to be a team in, and we cannot look to plunder one area or one sector or so, but we all must make sure that yes, there will be a cost, quite likely, but that we can all survive this and get through this.
And just to make the point on the NIS issue, the NIS representatives will be at the meeting on Thursday afternoon. Because the NS has a role, they would have, but I don't think they ever they were prepared to dealing with this at a financial level. But they would have to make some contribution to the workforce if, and God forbids, that we do have to take more drastic actions in terms of people not going to work and at the same time having to be supported. So hopefully we won't see a lot of that, but you never know. This is not a normal situation that we're facing.
Pleasant. Good morning, everyone. Nisha Paul, the New Today newspaper. My question has to deal with the test. How many have we acquired, and how will they be? What's the process? I think Mr. Mitchell had to give a little explanation or demonstration.
Well, let me answer that for Dr. Mitchell, because I have the most up-to-date numbers. We have currently 25 of these tests on island. That is what is prescribed by Pan American Health, because there is a protocol to follow. So if we suspected somebody of having COVID-19, we would test them with this swab. It's inserted in the nose. This test tube is sent down to CARICOM. We have two protocols set in place for that as well. If it is where we think there is community contact with that person and we need to know immediately, we have arrangements with RSS aircraft to come collect the test and bring it immediately to CARICOM. If it is that the person is in quarantine, already isolation, and we do not think there's community contact with that person, somebody who just came in or so, then we would send it via Quick Pack or by courier with one of the airlines. Within 4 hours of receiving it, CARICOM will give us the results. Once we have those results, then we will make a decision based on if they're negative, then the person can go on. If they're positive, then we act accordingly. In most cases, if we are going to test somebody, we're not just going to test for COVID-19, we're going to test for influenza as well, in order to determine whether the person has COVID-19 or influenza, because the symptoms are very similar.
Okay, in terms of I'm hearing a lot about
Oh, sorry, and as to why there are only 25, once any country within the Caribbean, the same as in China and the same as in Italy and France and so now, it is that once you have a certain amount confirmed community spread, then you would assume that all other persons who are symptomatic like that are the same. So we would test, once we get to 25 positive cases, God forbid if we got to that, then we would stop testing at that point. And we would be treating it that everybody who has the symptoms has COVID-19.
Okay, in terms of quarantining, where is our quarantine facility and what is its capacity?
That question does keep coming up, and I do purposely keep avoiding that question because of the level of hysteria that's out there and disinformation that's out there. We have safely quarantined people in different locations. Depending on the individuals, they have been safely quarantined in different locations. Some of those individuals have been released from quarantine already. We have asked them to also not say where the places are, because you have what's referred to as NIMBY, not in my backyard, or so. Nobody wants it to be in their area, even though we know scientifically that once it's 10, 15 feet away from us, they'll be safe. but there's still a certain level of discomfort. So in order to prevent any hysteria, we have been using our discretion and not saying where those places are. We have however, announced where our flu clinics would be should there be the need for our citizens to go somewhere if they thought they had COVID-19. I think that's more important and relevant than where people are being quarantined, because in some instances, as you are very much aware, we can exercise self-quarantine. If somebody lives alone, we can tell them, okay, you live alone, you stay home and self-quarantine.
Just to reinforce the point made by the minister, it would be very unwise to disclose a quarantine place because there are obvious reasons. And in fact, the press has a fundamental responsibility in this period. You know, the press must see itself as part of this whole equation, not by itself just reporting for people to run for news. The press has to be also manage itself responsibly. It should be doing so all the time, but particularly now, the press has a fundamental responsibility to help in dealing with this problem, because the press is also part of the society. And so I just want to reinforce that point. We don't want to disclose it. We shouldn't really attempt to disclose it.
Thank you very much. To date, can you tell me how many persons have been quarantined to date?
19 persons have been quarantined to date. 19 persons.
And how many released from quarantine?
As far as I'm aware, I think about 9 of those. Yeah, 9. Yeah. Some didn't stay for the full quarantine period. In other words, they were foreigners, and they elected to leave on the next flight out. But in total, 19, and 9 are no longer in quarantine.
Okay, Minister, you mentioned that there was some misinformation going around. If you don't mind, can you speak to the misinformation that is circulating and provide some clarity in that regard, maybe?
It's sort of where to start. I think what I would do is instead point you to the Ministry of Health's Facebook page and the Ministry of Health's web page, and that is a source of information. And you can use Pan American Health Organization as well, their websites, CARFA's website, WHO website. But there are a lot of other, I saw something yesterday that purported to be UNICEF, but wasn't. So there are a lot of other slides or one-page pictures and so that are circulating. Be careful of that. We at the Ministry of Health, Dr. Mitchell, we have absolutely no problem with that, and most definitely encourage. You hear something and you want to verify, you can contact any one of us. I've been taking all of your calls, and all of my team have been taking all of your calls, and regardless of the time of day. So you hear something and you want to know, and because you may want to be the first to break the story, no problem, contact us. We will give you the facts. If we know it, if we don't, we will tell you, hey, give us a moment, we'll get back to you. And I think once we continue that relationship and that protocol, we will move forward. And when you call to ask us about something, I mean, give us what your storyline is. Don't take a quote from Dr. Mitchell or myself and then twist it to say something else. We're here to communicate with each other.
Yeah, I just want to make a point in this, because in the past few weeks we have seen some things purporting to come from media houses, which I think is just highly irresponsible. I've had stories of the aircraft coming 2 o'clock in the morning and the people hiding, they don't know where they are. And this is an absolute nonsense. You know what I mean? So somebody want to bring people in this country to cause disease in the country, and they live here too? Give me a break. You know, there's some limits to which some of us go. I mean, no, we have to call it out for what it is. Highly irresponsible. Another case, a poor bus driver goes in to pick up some people in the airport. People have been out of China for almost a month. But it was reported that a man, and they named the bus driver, that picked up these people with virus. So you know what happens? People don't want to travel on the man bus. This is horrendous. What limits do we go? You know, come on, we must have our conscience. We got family and friends. That's why I'm asking the press to also manage itself. So if a member of the press is misbehaving, sometimes I wonder where our friends, what do they call the press? The official what?
M1.
Where's M1? Only when the government does something, the M1 speaks. If a member of the press is done something ridiculous, then it has to be called out, not by the Prime Minister, not by the Minister of Health, but by MWAG. Where is MWAG in this process? You know, we gotta be much more responsible. But all I can do is talk about it. I'm not a press man, so I've been the victim for years. But I don't think I'm a victim anymore. They give up on me. They give up on me.
Okay, I just have one more question as it relates to there are speculation is rife that the Chinese nationals who came on the plane that was turned away last week, Monday, were coming here to discuss business as it relates to the Belt and Road Initiative, and they have been traveling around the region to have these types of discussions. Can you confirm or speak to that, to provide clarity?
My comment is the plane came, the plane was turned back, the plane is no longer here. When it left here, it went to Barbados and then to Panama, and we don't know where the plane is after that. As I've said, you asked me that question yesterday, and my answer is still the same, but I will say it publicly here. It matters not what people were coming here to do. It's whether they had a travel history from certain hotspots that we will turn them away based on their travel history. If we start digging deeper, there were 2,000 people or 3,000 people that we turned away yesterday on a cruise ship. Are we going to ask each one of them why they came here or what their intentions were or who they plan to speak to? Or are we simply going to assume because they were on a cruise ship, they were all here purely to enjoy our beautiful country? If we turned away individuals which we have that came in on American Airlines or came in on British Airways and put them in quarantine, do we ask them why? Is immigration's officer's right to, but is that for the public dissemination? Or is it more important that based on their travel history, they were quarantined or they were turned away? And I still stick with that. It matters not, and I didn't ask, and I am not going to ask what you're coming here for. It's where you've been.
All right. Akeisha Felix, GVN. Hold on. That is not Corona. All right. Okay, so you would have mentioned some of the countries the travel ban is actually imposed to. So you listed Italy, Germany, I think, and a few others. Would you say these countries, the tourists, normally frequent Grenada more as opposed to other countries that have, other cases? What is the strategy used by the government to select some of the countries that are actually chosen to, to have the ban imposed on?
The strategy is based on where we see widespread community transmission. Widespread community transmission and in our opinion, where it's not under control. So that, for us, presents a risk to our citizens. So Italy, Germany, and I can be frank, we have already discussed with Foreign Affairs for them to, and it's figures-based. Quite likely before the end of the day, it would be France as well, because we've seen widespread. But this is our initial response. At a certain point, you can't continue with that. We are doing this because, in our opinion, this will help delay what is quite likely and inevitable and help us to be prepared, more and more prepared. But at a certain point, you can't close off the whole world because you need to allow your own people to come back home too if they want, and those countries will be sending them back home quite likely. But for the time being, we are implementing this policy. Other islands are not, but we are. And yes, the majority of our tourists also are from those destinations. Regrettably, the ship hasn't made a decision as yet, but the ship has been informed. Aida Perla, which is supposed to come in tomorrow, We've seen the manifest list already. I would say 90% of the individuals on that ship are from Germany. So we would expect AIDA not even to come to us to ask if they can come, that they would bypass. But if they did ask, we would have to see if there's a travel history that all of them were in Germany in the last 14 days or so, we would deny. It's just not practical.
Keisha, I must say that's a very good question that was asked there. And it's something that clearly we have to all be concerned about, because we can't close off this country to everybody. Yeah? We have to continue to live. And it seems to me that we have to also, that's why this is an international problem, and we have to be straight and honest with each other. So it seems that the ship and the cruise lines themselves ought to check their passengers appropriately to make sure they were not exposed to the places of where the problem exists at the community level. And based on that, because we can't just say because the Italians don't let them come. That don't make sense. That means we'll be killing the tourist trade completely overnight and without logic, because the ship that was turned away and a lot to do Trinidad went and issued a ban and psychologically put a lot of pressure on us. So it was not necessarily facts-based. I don't know the facts related to it, but we acted, and I'm not sure that necessarily was the best thing to do. Barbados accepted them, and so on. Just like, and Barbados still don't have any COVID problem. The same flight that we said with the Chinese passengers, Barbados accepted them, and they were very pleased, and the people were there for days. So one has to be very careful. At the same time, you have all these vendors out there hungry and looking for a livelihood, and they were waiting. Some of them bought stuff for and spent a lot of money and invested in these people coming here. And so one has to be extremely careful if we don't overreact. Because I think a lot of time we might be acting out of fear only, without facts. And I suppose the Ministry of Health and the government as a whole has to act on facts. It must be facts-based, not fear-based. And that's what's happening now around the globe, where people are just fearful, and there might be a lot of hysteria, sometimes unnecessary. So, but it's life and death, so you can't really tell people not to be frightened. So I just want to make that point. Like you said, as I said, it was a very good question you asked.
Well, thank you. All right. In light of the postponement of the Grenada Invitational, we know it was only, a month away, basically, and Carnival, it's a few months down the line. So what sort of development you have regarding Carnival and COVID-19?
It is my sincere hope that by then it will not be an issue, that we can celebrate our Carnival. We have to take this day by day, week by week, and we'll make determinations in August or in July or in June when we get to June, July, and August. For now, we're making decisions for March. And so too, I think most of the world, this is a new thing then. Two parts of it, the possible pandemic and also the information overload from it, so that we are able to think through many things, those kind of the good questions and all of the questions that are being asked. But I think it's too early to talk about Carnival. Let us be optimistic, not just here in Grenada, but for the world, that the healthcare professionals worldwide would have had this under control by August.
Minister Steele, how soon will we be able to test for COVID-19 ourselves? I know we spoke about buying equipment before.
The equipment has been ordered, as I've said. I actually asked yesterday and this morning again if I can get an update, expecting that question as to what day the equipment would be here. I still don't have that. I'm assuming that it is 10 days away from today, because I haven't been, at minimum, 10 days from today, because I don't have a confirmation that it's physically shipped. So within a 10-day window from today, but trust me, as soon as we have that, we will release that on the Ministry of Health Facebook page and website.
We have 25 kits. How would it be distributed?
The kits are going to be used when necessary. Now, the protocol, if once there is a doctor or healthcare professional anywhere in Grenada or at our ports or so, that will be handled immediately by Dr. Mitchell. As to whether he would do it himself or not, he can answer the question in terms of the protocol once we have the need to use one of these test kits.
The team at the ministry, who was, of course, headed by Dr. Francis Martin, the CMO, will basically distribute on demand, making sure, though, that the cases fit the definition for testing. In other words, we're not going to just go wildly just like testing folks. We have to fit that particular definition to be tested, especially in the first rounds, because, as you know, the hysteria that we're trying to quell, can push folks to say, okay, yes, I have the cold, I want to get tested now. And you have not been anywhere, you have not been in contact with persons who have COVID, you have not traveled to one of the countries where you have community transmission. So we're managing that, and I think the process is as smooth as we can possibly get it.
Hello. Minister Steele, last briefing you spoke of ventilators, right? And as you know, the virus attacked the respiratory system. Where are we with that? And also with regards to the oxygen tank, is it operating at its full capacity?
Additional ventilators, portable ventilators, as well as the full-fledged ICU ventilators have been ordered and are on their way here. With respect to the oxygen plant, new oxygen plant has been ordered as well. But in the interim, we give instructions, and I have confirmation from the hospital director that we have tripled up on the amount of oxygen that we would have at the hospital at any one time. So we've increased that threefold to make sure that we are able to fend for ourselves, so to speak, between now and when the oxygen plant arrives. But that oxygen plant, I would think, would be a couple months between arrival and between now when we're speaking and installation. So between now and then, we would have to be relying on the current oxygen plant's capacity as well as the oxygen that we purchase.
Okay. Given the fact that there is no cure, right, no scientific cure as yet for COVID-19, right? Let's say, God forbid, someone is tested and they're positive for COVID-19. I understand that you're saying the person would be quarantined and so, but if this individual has COVID-19, let's say if I have it, what happens to me after I find out that I have it?
All right, so let's distinguish very carefully between the terminologies that are being used. Quarantine and isolation are two different terminologies. Quarantine is for persons who are coming from areas where we have active transmission. It does not mean that that person has been in contact or has symptoms or is sick. And we've been doing this very efficiently from since the outbreak started and we started our response. Isolation is a different term. Isolation is for obviously persons who have been in those areas and are coming down with respiratory symptoms and have a strong suspicion that they do have COVID-19. And that is a suspected case. That person is isolated, and we have isolation facilities that we are improving on as we speak until the issue of confirmation. Because don't forget, you can be suspected, but it does not mean that you have COVID-19. Remember, the symptomologies are extremely similar. I mean, it's a respiratory tract infection characterized by cough, wheezing, runny nose, and in most severe cases, shortness of breath, etc. So that and let me add here that as far as we're concerned, as far as we've been told, as far as the data is coming out, the vast majority of persons who have COVID-19 do not go on to express severe illness. So that you may have COVID-19, let's say that you're tested, but it doesn't mean that you need that kind of service or hospitalization that we're extremely fearful about. The persons who will need that are persons who, as we continue to say, and as the data has been showing, are immunocompromised or have some other issue and have progressed to reach that level that needs support, respiratory support. And that's what we are trying to prepare for as we speak. And Minister alluded to the fact that we have ordered additional ventilators and other supportive mechanisms to be able to adequately treat these persons. So yes, you are isolated, and depends on the severity of your case that needs medical support. That is what we bring to bear.
I think a best comparison is, for instance, Zika. Although Zika is our most recent and is spread by a vector and is not like the COVID, but many people got it. Some people got it very severe, and some people very minor. And then there were those few cases that needed hospitalization, that led to Guillain-Barré complications, etc. And so you're going to have that variation. In this case, because the world has been looking at it, we have a fair accuracy as to the percentages. That 80 to 85% of the people are minor cases. And other symptoms, just a slight sore throat or aches and pains or cough or so. But our concern is the 20%. And of that 20%, the 5% that are severe or death. And that's what we're focusing on with those numbers and doing the extrapolation, that if it were widespread release. Because remember, even in the countries like Italy or Germany and so now, and even China, it still is a percentage of their population that got it. So a small percentage. I mean, the numbers to us are astounding when you hear 100,000, or you hear for China 80,000 in China. But that's 80,000 in 1.5 billion. So it's a small percentage. We are assuming and expecting, with the preparation, with the education, sensitizing of our public to, that God forbid, if and when it were to arrive in Grenada, it would be a small percentage of our population that would get it, if there were community spread from it. But we have to prepare for the worst case scenario as well, and that's what we're doing from the ministry standpoint.
Minister, I have 3 more questions. Okay. With regards to COVID-19, has this virus pushed the ministry to strengthen its capacity?
Any health event pushes the ministry or any public health authority internationally or but specific this ministry to strengthen. Yes, it's a general principle that you learn, you get stronger, you get better, you improve. This one, yes, we will come out of this one a much stronger, much more resilient Ministry of Health. Yes.
Okay, so we're moving away from COVID-19 now, so we're speaking dialysis. Just 2 questions. Okay, can you give us an update on payments to kidney patients by the government to subsidize the cost for dialysis?
The standard payments continue, and government did announce, and we are adhering to that and practicing that the total amount of government support is 3,000, but the payment to individuals remains at that 1,000, and the 2,000 is used to subsidize the dialysis, to make sure that individuals get that dialysis. Whether it is between now and the next couple of weeks until we have our own dialysis system set up, whether it is making sure that the supplies are paid for and readily available for individuals, and then as we progress, it is to make sure that our dialysis machines and supplies remain available for those who need that support.
Some patients are saying that they will no longer be receiving that money. Can you confirm or deny?
No, the arrangement right now, as it has always existed, is that the Ministry of Health or the Government of Grenada gives, through the Kidney Foundation, 1,000 EC dollars to those who qualify for that financial support. Earlier this year, we changed the government support for those who qualify for it to $3,000 to ensure. But the government still gives the Kidney Foundation that $1,000 for those who qualify. The additional $2,000 that we put is the Ministry of Health making sure that the supply and the dialysis is available for the individual. Because remember, these individuals who qualify financially, they also need to have regular tests, they also need to have restrictive diets, etc. And so that's what that 1,000 goes for. The additional 2,000 that we are putting forward is to ensure that these people get their dialysis at minimum twice a week, but ideally 3 times a week.
I know I say I had 3 more, but one more. The measures that were implemented to monitor and conduct surveillance, are they permanent?
Surveillance on, you mean, for instance, with COVID? Yeah, those measures have been in place since 2015 in terms of the thermal scanners at the airport. The additional surveillance, which is looking specifically at persons with a travel history from certain areas and so won't be permanent after those areas no longer have active community transmission, like I would expect quite shortly from the trends we're seeing. China will probably be removed from the list from most of the world, and including here in Grenada. Not yet, but quite soon based on the trend we're seeing. And as we have alluded, as it spreads other places, you can't just put each and every single country. You need to make sure that your surveillance methods are in place for people who are symptomatic or who are at high risk. So we've always had that. Since 2015, the thermal cameras have been at the airport. But to refer to your previous question about getting stronger, getting better, we put additional cameras in within the last weeks. To make sure that we had that. So we would continue that level of due diligence, because that is what Port Health is supposed to be doing, monitoring for the importation of various diseases. There's still widespread influenza A out there as well, so there's reason to continue monitoring that. Every now and then there's an H1N1 scare, or bird flu or others. So yeah, we will continue to monitor. But I think with this, definitely in Grenada, we're going to be stronger and have better capabilities from experience, one, and from additional equipment.
Minister, may I add here, and I am speaking as ex-CMO here, and not particularly a COVID coordinator or, currently working at the ministry. But what I know is that we will come out in general, and I think public health in general will come out much stronger at the end of this. To address your question specifically, all those measures that we are looking in terms of surveillance and monitoring, not only the Ministry of Health is actually on top of this, but for example, immigration and the advanced passenger list, etc., those have been refined and updated so that we can get information beforehand about travelers, and that would be something that is, in my view, permanent. The association with the cruise ship industry, that has been strengthened. I think we have a better working relationship with them now. The need for the cruise industry to ensure that the passenger list and the sick list, so to speak, of both passenger and crew, that we get it in advance and that we can actually act on it, as Minister was alluding, whether it be COVID now or an outbreak of diarrhea on the ship, etc. We have fine-tuned those mechanisms, and it has given us an opportunity, not only here in Grenada, but in the region, to be in a better place going forward in terms of public health and the risk that it poses to our countries in general.
All right. Thank you very much. I think we have exhausted all our questions.
I have a request of you, members of the media. Readily available on our Facebook and website are the various PSA posters, videos, etc. I am looking forward. I am saying and assuming that we don't have to officially write the media houses and ask them to put them out. I think the media houses should grab the initiative, pull down some of the officially certified PSAs, whether they are for print or for television, and to pass them out. I think they should be on any and all of your newspapers, at least 2 or 3 pages with it, and for those television and radio, at least once an hour, to be playing some of the PSAs. But I leave that up to the media houses to decide how active they're going to get involved. But we will be officially requesting that you give us a certain amount of airtime and print time for this, what is most definitely, we'll all agree, in the national interest to educate the public and pass information on.
Thank you, Minister. Dr. Mitchell, are there any final words you would like to add as well?
No, we continue to fine-tune our plans and preparations, and the partnership issue here is of utmost importance. We're speaking to it. We want not only the media but everyone to come on board. This is a national issue, as you know, both the Prime Minister and Minister Steele mentioned, and I'm really looking forward to working and coordinating all the efforts going forward in regards to the response to COVID-19. Thank you.
Thank you to the Honourable Minister Nickolas Steele and to Dr. George Mitchell, COVID-19 Response Coordinator. And thank you to all of you colleagues for coming, and of course all of those of you who are viewing via GIS Television Channel 22 and as well as online. We do thank you so much. And of course, as was mentioned, let us just all be as responsible as we can in ensuring that we disseminate the correct information and do not unnecessarily spread fear and panic in the country, because it does nothing for any one of us. So thank you, each and every one of you. Have a great day.